Here we go. Can we welcome Amir from UPL?
Thank you so much. Good morning to everybody and a warm welcome to this event. I'm Amir from Universal Pathology Laboratory. We are accredited pathology services and we offer affordable rates for the community and surrounding areas. Our mission is to deliver cost-effective, accessible rates and healthcare solutions to the community. And our vision is to become the pathology services of choice in the Western Cape area. We do have an exhibit outside and we're offering 100 free PAPs today for the community. So please take a free and take advantage of that. And we'd like to thank Dr. Musa and the team for hosting us and giving us this opportunity. Thank you so much.
All right, do we still feel alive? Are we still in a good mood? Oh, sorry.
Sorry, I think I missed our sites. So we based numerous depots around Western Cape area. It's the Wynberg area, Kales River area, CBD, Athlone, and we are expanding through the Western Cape. So please feel free to come to our stand and we can provide all the contacts to you. Thank you.
Thank you so much to Amir from UPL Labs. Okay, as I was saying, are we feeling alive? Are we feeling great, in good spirits? Yes. Can we continue? Do you want to stretch? Are we fine? I know Sister Dre did an excellent job, so hopefully we're good. Right, we're moving on to our next session, and we'll look at conditions that are often called our silent killers. Hypertension, diabetes, and...
She's done that.
Oh, we're done with that. All right, no worries. Okay, so lastly...
Jaffer.
Yes, Dr. Jaffer. Right. We'll focus on one of the greatest challenges in healthcare today, which is cancer awareness. Early detection can save lives. All right. We now welcome Dr. KhadijaJaffer to present her talk. Shukran, Dr. KhadijaJaffer.
Good morning, Assalamu alaikum, welcome everybody to the end of the session. I hope you found it very useful so far, our health talk. So we'll try and get through this very quickly because I'm sure most of you want to, and we would like you to continue to the rest of the program to this morning. I'm sure, I don't even have to ask because it's becoming more and more frequent for somebody to be diagnosed with cancer. How many of you know people, close family members, yourselves, your children, your parents, your siblings who have cancer? Can I just get a quick show of hands? Yeah, that's a lot. If we look 20 years ago, we would not have gotten maybe even 2 or 3 people raising their hands. It was that unusual. Or people didn't know. They're not sure. We're fortunate in that we're living in an era where people are more aware and people are able to catch cancer at an earlier stage. And why is this very important? It's important because the earlier you pick it up, the more chance there is of having a successful treatment outcome. Okay, so we're not doing this because we want to scare you. We don't want to scare people. That's not our job as healthcare practitioners. But we want to educate, inform, and we want you to be aware that these things are real. They do exist, and it can happen to anybody. You tell yourself, oh no, I don't have a family history of cancer, I eat a good healthy diet, I'm not overweight, I don't smoke, I don't drink, I exercise regularly, I'm good. No, you're not, because we don't know when God will test you with something like cancer. So the purpose of this little talk this morning is just to raise awareness so that people can be a little bit more alert for yourself, for your family and your loved ones. Maybe you're not going to be affected, maybe somebody else, a neighbor is going to come and tell you something, and then you're going to remember what we spoke about this morning, and you're going to be able to help that person. Okay, so nowadays we're focusing on this because, as I said, we want to pick up the cancer if it is there as early So, as I said, we said it's a very high leading cause of death, early detection saves lives, etc. We have covered that. Sometimes cancer comes on slowly and you only become aware of it when it's almost too late. Sometimes there are sort of warning signs which you've ignored and you thought was just, that's nothing. So this is really to bring all that to the fore. Okay, so we want people to know. So one easy way for us to remember is something called caution. Caution is to be careful, you're aware of it, you're thinking about it. So these are the topics that I'm quickly going to run through. Okay, can you all see? Yeah. But we'll go through it one by one if you didn't see. So the C in caution here stands for a change in bowel habits or your bladder habits. And this is very important for the cancers that affect those areas. So for your colon cancer, your stomach cancer, your bladder cancers and all of that. These are sometimes some of the early signs and things that, you must be alert to is you've always been a regular person. I mean, I'm talking about funny things now early in the morning, maybe some people didn't, but you've always been regular. You're a year in, year out. And then suddenly you start becoming constipated. And you've just sort of hit 50, but you're constipated, and this is unusual, and you didn't change your diet, and you didn't change your water consumption, or take new medication that could maybe make you constipated, and it's happening. Don't ignore it, okay? This is one of the early signs, or could be one of the early signs of cancer of the colon. The same goes with the opposite. You never had diarrhea. You're not trying to use, but it happens now. Regularly more than regular stools getting loose stools. And, it's not clearing up like a tummy bug. Just like that all the time now. Don't ignore it. The same with any blood that you see. Whether it's in your stool or in your urine, take it seriously. Blood in your stool and urine is abnormal. It should not be there. So if it is there, it means there's something. Not necessarily cancer, but there is something. So don't ignore it. Okay. What does the A stand for? A sore that doesn't heal. And what kind of sores are we talking about? We're talking about something that could be in your mouth. We're talking about something that could be a wound on your body. Something that's just, it looks like a little pimple or a scratch, but no, this is not going away. It's festering, it's just there all the time. Don't ignore it. Especially if you're a smoker or a heavy drinker, because there are certain cancers that are more common in people who smoke. And then, for the females, an unusual bleeding episode or discharge, especially the ladies who have reached menopause already. So now you've stopped, you don't have periods anymore. And suddenly, like 2 years later, here comes something that looks like a period. This is not normal. It must be checked out. Okay, so sometimes you get scared, you think, what is this happening to my body? Or you think, oh, it's nothing, this is just another period, maybe, it's like late menopause or whatever changes. No, this is not normal, and you need to have a doctor or a sister or somebody at the clinic at least know about it. And again, blood anyway, not normal. And then when we talk about the T, we're talking about thickening or a lump. And this is a lump or some area, skin tissue, something that does not go away. Again, it wasn't there before. You know your body better than anybody else. So you know that this lump was not there. And the common places to look for is under your armpits, in your groin, in the neck area, behind your ears, anywhere where the middle of your throat, these kind of things, lumps that don't go away, that wasn't there before all your life, you didn't have a lump. Again, maybe not cancer, inshallah not cancer, but don't ignore it. The I stands for indigestion or difficulty swallowing. Again, these are the things relating to the throat and the stomach and so on. So you've always been able to eat and it was always okay, but in an older person especially, if you get persistent heartburn and indigestion and you've tried all the medications especially and it doesn't settle, it doesn't help, especially if you are losing weight at the same time. This is a very combination of two important symptoms. Again, go for your checkup rather. Go and have it seen, to speak to a professional about it. And even this feeling that, you're choking on your food, that's another kind of thing. It could be anything, but it's not like it used to be. You used to be able to eat nicely. Food felt like it went down. Now it feels like you're choking. Go for it. All right. Another common one is, everybody has a little bit of a wart or a mole somewhere in their body. Now, especially a mole. If you see your mole that you've had, diagnosis, but and from childhood has been on your cheek, but now it became bigger, it became darker, it started bleeding, it became itchy, it became painful. That's not normal. That mole should stay the way it was as a child. It should stay like that without changes throughout your life. So when you see that those changes are happening and you're not sure, again, rather have it seen to. It might be nothing, but this is not something you want to ignore. Okay, and this one is especially important for the smokers. A cough that doesn't go away. Okay, so sometimes we do know people have a bad chest infection and then they cough and cough and cough for weeks thereafter. And that's fine, but even there you should have it checked. Like a cough that doesn't go away and just stays with you and lingers isn't something you must just accept and say, okay, it's probably allergies or whatever. Especially if you're a smoker, and especially again if you've lost weight or you're sweating at night, because then you're looking at possibly TB or some forms of cancer could present this way. Okay, so as I've mentioned in some of the other things, the general warning things that you don't want to ignore are these kind of unexplained weight loss, being very tired, feeling fatigued all the time, and you just can't put your finger on it. You're not sick, but you just don't have the same energy as before. You've lost your appetite, you really don't feel like eating, especially if it comes with either the diarrhea or the constipation, as we spoke about. You've got pain, especially bone pain in your bones that you never had before, and infections, like you're constantly sick, or you just can't shake it off. Look, there's many other explanations for this. You could be diabetic, HIV, some of the more unusual illnesses that drop your immunity, but the reality is it could be cancer. So these are the things you don't ignore and you have your children. At least start there. Let your healthcare practitioners take care of the rest. Your responsibility and duty to yourself. And the amana you have to your body is that you don't ignore these things. You are aware of it now, hopefully a little bit more educated. You say, well, you know what, rather let me see. Hopefully this is nothing. But I can go and have it checked out. And again, we're talking about lots of different causes, health issues that could be causing your prolonged cough. But the one you don't want to miss is obviously cancer. And that's for your healthcare providers then to take it further with other tests and things like that. Just to tell you that before we even get to that stage of clear way of warning signs, and this is something that the younger mothers and the people who are raising children must be very aware of. A lot of the cancers that we see, and maybe one of the explanations as to why it seems cancer is more common, is not just that we are picking it up, but that also maybe there are environmental factors that are adding to this. We can't be sure, but for sure, being a healthy person reduces your risk. And there are definitely cancers that are associated with things like smoking. We know that cancer is higher, lung cancer for sure is higher in smokers, but there are other cancers that seem to be higher in people who smoke as well. And the same with alcohol. I mean, your diet also plays a huge role in how healthy you are, and whether there's going to be this chronic inflammation, which may then, you know, we don't know, but could possibly be a lead up to getting cancer. Exercise is protective. So nowadays we talk about exercise being medicine. You know, so as important as eating well and staying away from those things, being active, you know, even if it's just walking, very important, as long as you're consistent and do it regularly. You know, so don't like it, now I'm going to go all out and get yourself like all this gym mats and, you know, follow a program even if it's at home and then you stop after a month. Now it should be a little bit but done regularly. And then, you know, where you can, didn't put it on the slide, sleep is also very important. Sleep is important for your overall well-being, your mental well-being, your physical well-being. So there's a big emphasis now on the fact that people don't sleep enough, or that, you know, they don't sleep in a very good quality sleep. So those are all important for prevention. And then, you know, go for your checkups, go for your screening. We're very fortunate this morning in that the previous guys who were here, they were our sponsors, and they've kindly sponsored us to be able to offer the community of Parkwood, the women of Parkwood, a pap smear test. Now, what is a pap smear test? Because some of you are booked for it and you may not have done it before. It's a very important screening test for women who are in the childbearing years especially. And this is one of those tests that can be done to pick up a very, very early stage of cervical cancer, or even what we call a pre-cancerous stage, which means that things have started becoming a little abnormal, but it's so slight that the test will pick it up, but that we can still do something for you to prevent it becoming cancer proper. So that is why it's really, really important. And I think, I mean, we're very fortunate, alhamdulillah, that we have this opportunity to do that. I know it seems like a scary thing for those who've never done it before, but you know, it's really one of the useful tests for a woman to do in her lifetime on a regular basis, and your doctors will explain to you if it's normal, when you will come back and do it again, when it's abnormal, then you come back and do it again, and so on. Okay, so it's something, you know, that science has provided us with a little bit of a preventative kind of test. And in this country, I mean, that's also one of the things that's covered even in government sector, that, you know, you can have a pap smear done. So if you've done it today and you know of your sister or your female neighbor or a friend who has never had it done, at least you can share your, you know, your experience with them. So even though cancer is real, cancer is there, there's nothing we can do. I mean, if you get it, you get it, but it is treatable, and the earlier you catch it, the better. So things like knowing, being a bit educated, sharing your knowledge, overcoming your fear, because I think that's a lot of what keeps women away. Sometimes, you know, especially October, next month, breast cancer awareness, I think there's been a lot of awareness, a lot of people know about it, but yet you'll find women coming to us and then they've got a lump and they've been aware of it for like maybe 3 months already, but because they now got reminded, Breast Cancer Awareness Month, they use that reminder to go for their checkup. Okay, so awareness is very important, education is very important, and overcoming your fears are very important. So thank you to all of those who signed up to come and do your pap smears and your breast examinations, and we hope that everybody leaves from here a little bit more healthy today.
Shukran so much to Dr. Jaffer for that eye-opening talk on cancer awareness. Do we have, before she goes, do we have any questions for her that you'd like to ask? Anything from our audience? Anybody with a question? No? Okay. So today, as I